Elevated blood pressure or hypertension is the most significant contributor to complications such as heart disease, stroke, peripheral vascular disease, and kidney failure. The consequences of these complications are devastating and deadly. It is important to remember that hypertension is the most significant preventable cause of cardiovascular and renal complications and premature death. It is the responsibility of the provider and members of the healthcare team to use a collaborative approach with proper blood pressure technique, education, understanding of the disease process, medication adherence, lifestyle changes, and the importance of data in hypertension population control. This is increasingly important with the newly released blood pressure guidelines. This series is designed to assist clinical teams to utilize a systematic approach to improve processes in their practices to ultimately improve blood pressure control. Welcome to Session 3. Each session builds on one another, so it may be beneficial to view them in order. Over the past several sessions, we have discussed methodology, collecting baseline data, and remeasurement, as well as correct blood pressure technique. This session will focus on identifying many reasons members have uncontrolled blood pressure. It is important for a clinical team to know and understand the causes of uncontrolled blood pressure and the effects of those causes in order to make good decisions about improvement interventions. This tool also helps prioritize interventions. This exercise can assist the team in identifying factors within their control as well as factors that may need attention from community or other resources. Last session, it was suggested that the team members begin listing as many reasons why patients have uncontrolled blood pressure. It is time to get out that list. Cause and effect gets to the root cause of the opportunity. The team delves deeply into the root causes of uncontrolled blood pressure to gain more of an understanding of what in the system or processes that may be contributing to the problem. A cause and effect diagram or fishbone diagram is a useful tool in performance improvement to help the team tease out common causes as well as those special causes that may need to be investigated for a first intervention and those in the future. Obviously, when it comes to hypertension or any chronic disease, the practice cannot control all factors. However, it is necessary for the team to recognize cause beyond the practice control and put processes in place to work around them whenever possible. The tool is called an Ishikawa diagram or fishbone diagram because of the shape resembling a fishbone. It is the science of causes and effects. It is a way of illustrating the causes contributing to an opportunity. The big bones depict the large categories of causes or drivers. The smaller bones document the whys that correlate to the large bones or categories. Once the diagram is complete, it will resemble a lot like this example, or like this one. The diagram can be done on butcher paper or flip chart paper and sticky notes. Later, the diagram can be transferred to Word, Excel, Visio, or other diagramming software. It is important to keep the diagram posted as it will be used throughout the improvement process to identify interventions. The original diagram, if done on butcher paper or flip chart paper and sticky notes, can be posted and used by itself. However, one word of caution: when sticky notes are used and in place, use masking tape to keep them in proper place as the sticky note glue tends to fade over time. Remember, the objective of performance improvement is to take the people out of the equation and instead understand the process behind the people. The bones are categorized by the team and the causes are decided by the team. The idea is to get to the root cause of the opportunity. To do this, the team completes the smaller bones based on the why of the cause. To get to the root causes, it is helpful to understand the theory of the 5 whys. Just like peeling a banana to get to the fruit, asking why peels away the symptoms to get to the root cause of the opportunity. The 5 whys was developed by Tachi Ono and was used by the Motorola company before moving into a significant tool for root cause analysis. Very often, the obtainable reason for one cause will lead you to another question. Although the technique is called 5 whys, it may not be necessary to ask why exactly 5 times, but sometimes more or less than 5 in getting to the root of a causative factor before the solution becomes clear. The next couple of slides will demonstrate the 5 whys. We start by identifying the opportunity or the problem. This example opportunity is that the service representative doesn't know the answers to questions or gives out wrong information to patients. It may be the first thought by the team that the receptionist needs to go, or that the receptionist has too many job functions. But using the 5 whys, the team works at getting to the root cause of the opportunity. The first why is asked. Why does the service representative give out incorrect information or doesn't know the answer to the questions? Because changes don't get communicated to the service representative. The second why is asked. Why aren't changes communicated to the service representative? Because the service representative isn't on the communication list. The third why is asked. Why isn't the service representative on the communication list? Because she was never added to the communication list. The fourth why is asked. Why wasn't she ever added to the communication list? Because her supervisor was supposed to keep her informed. The fifth why is asked. Why didn't her supervisor keep her informed? Because her supervisor left the company a year ago. The intervention as a result of this exercise include the service representative on the communication list. This example demonstrates the issue is with the process and not the person performing the function. Here is another example. The opportunity is the patient diagnostics are delayed. A delay in getting a CT, X-ray, or MRI, for example, could result in delayed treatment. The first why asks, why did the patient not get the test? The answer, because the test was not ordered. The next why asks, why was the test not ordered? The answer, the patient has an insurance that requires authorization. The next why asks, why wasn't the authorization done? The answer, the provider office did not begin the authorization process. The next why asks, why didn't the provider office start the authorization process? The answer and the final why gets to the effect of the opportunity, which is this particular provider office had one person doing this function and that person was no longer employed in the office. Solution, train another person to do the function and then cross-train several staff members to be able to complete this process. The exercise begins with a simple drawing. Draw the big bones at first and be sure you leave a lot of room for smaller bones. Sticky notes are nice for this exercise because they can be put directly on the flip chart paper under the categories, making it easier to complete. Next, place the opportunity or the problem at the mouth of the fish. We refer to this as the effect. When using this tool, it is important to be specific and clear about defining the opportunity. In our case, the opportunity is defined as uncontrolled blood pressure. In future performance improvement activities, the opportunity is a team decision. Next, agree on the big bones or major causes of the opportunity. There could be more or fewer than 4 big bones. Depending on the opportunity, big bones can be related to equipment, people, policies, and procedures, methods, materials, supplies, communication, patients, environment, office staff. Well, it can go on and on. Next, agree on the big bones or major causes of the opportunity. For this series example, the big bones will be labeled as methods, people, materials, equipment, and supplies. Next, the team will work on smaller bones or causes related to the big bone categories. The examples on the next slide will demonstrate how to identify causes in the big bone categories and drill down as much as possible. This slide emphasizes patience under the people category and is spotlighted for attention. Also, in the following slides, different colors are used rather than lines for more emphasis. One of the causes patients may have problems controlling blood pressure may be related to non-adherence with medication. A few of the other reasons that may be brainstormed for non-adherence are finances, formulary restrictions, denying they have the disease, and psychological problems. In the next few examples, for emphasis, different colors are used rather than small bone lines. Drilling down with finances and asking why finances is an issue with non-adherence. The patient may have Medicaid, which doesn't provide coverage for certain medications. Here again, the formulary cause is displayed for emphasis. If why is asked again, the medication that is prescribed for the patient may not be covered. If why is asked again, the team may find that the provider has not contacted the insurance company to intervene for this medication for patients. This real-life example sometimes occurs when the provider prescribes combination medications for a 90-day time period. Continuing with other causes under non-adherence of medications, disease denial is revealed separately for emphasis. The causes for disease denial may be because of a knowledge deficit, lack of understanding, and culture. If the question why is asked under knowledge deficit, causes may be related to the fact that the patient used the ER for primary care or moved from provider to provider, and there was no consistency or initiation of education regarding high blood pressure. Culture may be a cause if the member feels high blood pressure is a sign of weakness. Even though the patient may have been educated on the disease process, in the best of circumstances, the patient may not understood for one reason or another. Language may have interfered with patient comprehension. Lastly, psychological problems may contribute to non-adherence and is exhibited for emphasis. A couple of reasons for this example may be related to forgetfulness and depression. Under forgetfulness, the team may discern that the patient has no help with family, friends, or caregiver in remembering his or her medication. This shows the patient's cause of non-adherence with medication in its entirety. Of note, for the purposes of time, several examples have been revealed, knowing that each practice may have many more causes. One word of caution: as the team is brainstorming cause and effect, the team leader and scribe should clarify the meaning of the cause called out by a team member. For example, language may be related to the cultural effect, but also related to the lack of education. The same cause may be attributed to other triggers. The entire team gets involved in creating the cause and effect diagram. Then, the team writes causes on separate sticky notes and places them on the diagram in appropriate big bone site. The cause and effect diagram helps identify what is controllable at the practice level versus what is not in the practice control. This helps when determining interventions now and perhaps later. Consider those processes for which the team may jump to the conclusion it is out of the control of the practice. Although the practice cannot control patient finances directly, the practice can be more aware of what the patient may be able to pay in the way of medications. Interventions can be based on portions of an effect that can be controlled. For example, one practice developed a funding project that was able to monetarily assist patients who needed it. Of course, this was a large, multi-specialty practice that had the ability to obtain outside funding. But what if this team had just said, that is something we cannot do anything about, and let it go at that? The practice cannot control a member's denial of the disease process, but can offer educational material designed to meet literacy requirements in the patient's preferred language, or perhaps get the patient into a support group or behavioral health. When seeking innovation interventions, seek out the processes rather than assigning blame to the patient immediately. Again, one of the major bones was enhanced to help with understanding. This time, the big bone displayed is equipment and supplies. Here, an example of some of the causes for the big bone equipment and supplies are blood pressure cuffs, BP machine, triage furniture, and educational materials. For blood pressure cuffs, a cause may be that sizes are not available. If asked why, perhaps they are not available because they're too expensive or they walk off because they aren't locked up. What other reasons can be added to this bone? For issues related to automated BP machine, the cause may be related to calibration or it may be outdated. Ask why. Staff didn't know about the necessity of calibrating. Why? Weren't taught, etc. Are these things within the practice control? The team decides. Think about what else can the team add asking why. Consider what the practice controls in this example. In summary, use the fishbone diagram to identify the cause and effect of opportunity. Identify opportunities for improvement that are within the control of the practice. Keep the diagram for reference for identifying interventions and focus on the process rather than the people. Next session's attention will be on the process flow. This session will offer steps to process a flow sheet based on the current workflow from call to triage and blood pressure check to MD medical exam. This workflow may be the most important one with the HDN visit because the blood pressure reading sets the stage for care and treatment. A flowchart is a picture of the sequence of steps in a process. This step-by-step pictures can be used to plan a project, describe a process, or document a standard method for doing a job. Flowcharts help the team members understand what is happening now and in the process. It is helpful to use flowcharts to build consensus with the team, correct misunderstandings of a process, and build a common understanding for all team members. We look forward to your joining the next session.